This time we talk about exterior and interior. So, uh, Wei Qi versus the pathogenic factor. So, if the condition is cold, exterior cold, there is mild fever, but the chills are severe. No sweating, no thirst. So, when we look at the tongue, it looks normal. The tongue body is normal with a thin white coating. The pulse is floating and tight. If it's exterior heat, there is severe fever, mild chills, there is sweating, and there is thirst. Tongue, the tip is red with a thin yellow coat. Pulse, floating and rapid. If there is deficiency, if it's a deficiency condition, there is mild fever, mild chills, spontaneous sweating, no thirst. Tongue is pale with thin or no coating. The pulse is floating, slow, and weak. For excess condition, exterior, mild fever, severe chills, no sweat, no thirst. The tongue has a normal tongue body, and thin white coat. Pulse is floating and strong. Now let's talk about interior. Interior cold, lack of warmth. Okay, so internal imbalances affecting the organ functions. So there's pallor, cold limbs, no thirst, or prefers hot drinks. Sputum is thin and white. Urine is clear, stools are loose. When you look at the tongue, it's pale or normal with white, slippery coating. Pulse is deep, slow, or tight. Now, for interior heat, drying fluids. Okay, you have a red complexion, high fever, thirst, prefers cold. There will be palpitations, irritability, urine is dark and scanty, constipation. Tongue is red with yellow coat, pulse deep and rapid. So, interior deficiency, there is lack of qi. So the patient is weak, lethargic, dislikes talking, quiet voice, feels dizzy with palpitations, poor appetite. Tongue is pale and swollen with thick white coat. Pulse is deep and weak. Now for interior excess, signs and symptoms are extreme. So there is high fever, heavy breathing, chest and abdominal pain and distension, constipation, delirium. The tongue is red with greasy yellow coating. Pulse is deep, full, and rapid. Relationship between exterior and interior. So if there is transmission from exterior to interior, that means the disease gets worse. The Wei Qi is weak and the pathogenic factor is stronger. Or the treatment is wrong, the imbalance is worsened. Transmission from interior to exterior, that means the disease gets better. Wei Qi pushed out the pathogenic factor. So that means you're doing it right. Treatment is right, pushing out the pathogen. So if you have exterior and interior at the same time, the external evil invading the exterior and interior at the same time. So this is a patient with chronic disease suffering from a new disease. Then we have intermediate syndrome between exterior and interior, Shaoyang, or lesser yang. The EPI, the external pernicious influence, fails to be transmitted completely to the interior, while the Wei Qi is not strong enough to expel it to the surface. So the evil is between the exterior and interior. Key signs and symptoms: strong alternating chills and fever.